How does gradual activity increase retrain your bladder? Imagine your bladder as a muscle that can learn to hold more urine over time. When you start bladder retraining, you don't suddenly go from frequent trips to the bathroom to long stretches. Instead, you take small, steady steps to help your bladder adapt. This process involves gradually increasing the time between bathroom visits, usually by about 15 minutes every week or so. By doing this consistently, your bladder gets used to stretching more comfortably, which can help reduce the urgent need to go and the frequency of urination. The first step is scheduled voiding. You set specific times to empty your bladder, even if you don't feel the urge. This helps create a routine and prevents your bladder from overreacting to small signals. When you feel the urge to urinate before your scheduled time, you can use urge suppression techniques. These include deep breathing, relaxing your muscles, distracting yourself, or doing pelvic floor exercises like Kegels. These strategies help calm the bladder muscle and reduce involuntary contractions that cause urgency. Next, you slowly extend the time between bathroom visits. Once you're comfortable with your initial interval, you add about 15 minutes to the wait. Over weeks or months, this gradual increase allows your bladder to stretch and hold more urine without discomfort. Strengthening your pelvic floor muscles through regular exercises supports your bladder's ability to hold urine and improves control. It's also important to avoid, just-in-case bathroom trips, which can reinforce the feeling that you need to go urgently. Learning to tolerate the sensation of urgency and resisting the urge helps recalibrate your bladder's signaling system. This entire process usually takes between 6 and 12 weeks, but patience and consistency are key. Many people see improvements in how often they need to urinate and how urgently they feel the need. In the context of bladder health and bladder cancer, bladder retraining can be a helpful non-invasive way to manage urinary symptoms and improve quality of life. However, it's essential to do this under medical supervision, especially if you have bladder cancer or other urinary conditions, to ensure safety and proper guidance. Sometimes additional treatments or therapies are needed depending on your specific situation. Overall, gradual activity increase retrains your bladder by helping it become more flexible, reducing involuntary contractions, and strengthening your voluntary control through behavioral changes and muscle support. Remember, always consult your healthcare provider to tailor the approach to your individual needs.